Okay, Dr. Haydon, we're going to do love it or leave it today.
All right, let's do it.
Okay. First up is Quantum RF.
Love it. Something that's really cool. It's bipolar radio frequency that allows us to do skin tightening. Sometimes when someone doesn't have a lot of fat, for example, we're not doing a lot of liposuction, this is fantastic. Goes in underneath the skin. We can sometimes do abdominal areas, for example, in the office. Really works well, minimal downtime, and provides something that we haven't had before, which is skin tightening on top of removal some of the fat.
Okay, next up, Ovally.
Love it. So with Ovally, one of the cool things about it is the first thing that really lyses strands, connect the skin that go through the fat, and you can literally go underneath with this little light. You can see where you are. We've got a little hook that comes out, and you can grab them, and then you can literally cut the band. Gone forever. You do some tightening with Morpheus over it, and it works fantastic. Very minimal downtime, maybe a little bit of bruising.
Threads.
Threads, hate it. A high breakage rate, very difficult, blind. You're just going in from a distant area, grabbing something, pulling it up, and then somehow expecting to do the same thing on the other side. Hate it.
ProFrac laser.
Love the ProFrac. ProFrac's really cool because you're going to be able to pull out pigment, but it does a better job of getting rid of the fine lines, wrinkles, etc. More powerful, for example, than the Halo. Downtime can be maybe 10 to 14 days, but absolutely love it.
Softwave.
Love it. Softwave, I think, is so much better, for example, than like old therapy. You can really control the depth, very little downtime, not burning down through and actually hurting the dermis. But you are getting some benefit in terms of bringing in collagen and volumizing the area. It can be done at any time during the year. It's not light sensitive and almost no downtime other than maybe just a tiny bit of redness.
Next up, Ultherapy.
Leave it. Ultherapy, very painful, very hard to control, and in my opinion, way too much damage, way too much scarring.
BBL.
BBL, love it. One of the things about BBL, which is broad-based light, is that this is something that's just done in a skincare clinic. Really been shown that over the years, really can help the quality of the skin. Those genes that are not expressed well, that are youthful type genes, can be brought back into action and can even suppress those that are aging type genes. You really get a very youthful look, but it has to be done times a year. We recommend almost for everyone do 3 BBLs a year and then do the stack, which is one of the times during the year you either do something like Moxie or Halo.
Drains, surgical drains.
Leave it. Drains. I don't know. Why do we still use drains? I mean, all of us that trained probably put drains in because that's what the guys before us did. But I can't think of the last time on a breast reduction or even capsulectomy that I put a drain in the breast. Tummies never use drains. Use progressive tension sutures and Exparel. Patients are able to get up and around so much more easily. Recovery is so much better. Drains suck.
Sculptra.
Love it. Sculptra is great. It's a biologic. It's something that gets injected underneath the skin. You're going to get some next week. In certain areas of the body where you kind of lose volume, when you put the Sculptra in, what it does is stimulates your own collagen to be produced. So it's not an artificial filler. You do it once and then repeat it 4 to 6 weeks later. The ultimate peak of the volume that comes in is about 6 months, but it lasts for a couple years. So it's a very natural onset, great look, and really can help areas that can be difficult to do with traditional fillers.
What about Cool Sculpting?
Leave it. It's Cool Sculpt. I have seen so many disasters with Cool Sculpt. It's very expensive, number one, and I understand there's very minimal downtime, but I have a lot of patients that come to me said it was very painful. They didn't get good results. They paid a fortune. Some can get paroxysmal adipose hyperplasia, where you actually get more fat rather than less fat. We have so many procedures now that are minimally invasive with very little downtime that get far better results, where we can not only remove the excess fat, but then get skin tightening on top of it.
External sizers.
Leave it. To me, External sizers, implants, like when you're going to someone's office, if they say, oh, just put these inside your bra, you can tell which one you want. To me, that's kind of like going into a store and you grabbing a dress off the rack, putting it in front of you, and somehow trying to decide how that's going to fit. Instead, we can use the Vector 3D imaging, which allows us to put different size implants on. We can show you with and without tops what it looks like. I can show you a size that I think is maybe a little small. I can show you one that I think is too big, and then I can show you sort of what I feel like is a range that you will feel like gives you the look that you want.